Considering your different birthing options, right? A lot of people don't realize that they even have birthing options. They normally just assume, oh, well, it's the hospital. So there are different options that you have, and what those options are, of course, is going to be hospital birth setting, and then there's going to be the out-of-hospital birth setting, which are home births and birth center births. Before I dive a little more into that, I wanted to talk a little bit about the difference between midwifery model of care versus medical model of care. Very two different approaches, and I'm sure you got a good feel for what that approach would be when it comes to midwifery care from my introduction video. With the medical model of care, their foundation and their way of going about birth is going to be very, very focused and centered on how they were trained in medical school, right? In medical school, they train their doctors to look at, diseases and sicknesses in a pathological way, meaning there's something wrong here, we need to fix it. It is pathological. That is what that means. And that is how they're gonna go about most of the time with birth, is close monitoring and interventions, because in order for them to fix something, we have to keep intervening. Another point to make with the medical model is that it is very centered around provider decision making, and majority of the responsibility on decision making is gonna fall back on the doctor, meaning that they have a harder time including you on those decisions, in decision making, right? A lot of time it can come with, fear-based decision making as well, where they're just giving you one side of things versus here are the pros and the cons, you get to decide. And with midwifery model of care, it's very different. It's the decision making is all up to the family and what they want and what feels safe for them. Of course, midwives, we have our guidelines and our standards and our boundaries, but we will always center it around their choices and decision making, and how can we work together as a team. And here is all the information regarding making this decision, right? Here are the pros and the cons, and now you get to decide for your family. With midwifery model of care, the approach is always going to be the less intervention, the better, right? Because if we don't intervene, we let the body and nature do its course, we know that it will unfold naturally, pretty much 98% of the time. And then when we do need to step in and intervene, if a complication comes up, then we step in. But it is not routine for us to do interventions and to disrupt the natural physiological process that we know and are experts in, because we see this all the time when we attend home births. Another great point to make about midwifery model of care is the continuity of care, meaning that this one midwife is the provider that you will always see for your appointments, prenatally, for your labor, for your birth, and for your postpartum care. So having that same person that you've built a relationship with, that you trust, they will always be the one to be there for your care. It won't be someone else. There are those rare occasions where births overlap and we may need to have a backup midwife, but it's very rare.